Today we're just going to run through bowel cancer, kind of what the signs, symptoms are, causes, etc. Just to raise some awareness for you guys. So bowel cancer is basically a cancer that starts in the colon, so the large bowel. It can also occur in the back passage, so your rectum, and it's known as the colorectal cancer. And it's also important to note that it can also occur in the small intestine, so your small bowel. So who's at risk? So obviously a lot of different risk factors, but obviously these are not limited. So they say that 94% of new cases are diagnosed in people over the age of 50 and 60% are diagnosed in people over the age of 70. So largely kind of in the older age group. However, it can affect anyone of any age. So there was more than 2,500 new cases which are diagnosed each year in people under the age of 50. So like I said, it can occur in anyone, any age, although the older age groups are obviously more prominent. So those with parents, brothers, sisters, sons, daughters, so those are kind of people in their family that have bowel cancer are more than double at risk. And 13% of bowel cancer cases in the UK are caused by eating processed meat. And your risk is also increased if you eat a lot of red meat. And also if you're overweight or obese, this increases your risk as well, with 11% of cases being caused by this. So the causes, so obviously drinking alcohol, they say 6% is caused by this. Your risk is also increased if you're a smoker, so 7% of cancer or cases are caused by this. If you've also got type 2 diabetes, you're also at high risk, so 22 to 30% higher. Also people with inflammatory bowel disease, 70% high risk, obviously because of issues with the bowel. If you've got too little physical activity, your risk increases. And also if you get too much ionizing radiation. So if you work in this sector, again, it's important to be careful when working around that. And also if you eat too little fibre, that can be a big cause. So just some statistics. The whole reason we do this today really is to make sure that we can prevent these kind of things. So 54% of bowel cancer cases are preventable. So that's why we're here today. So to do kind of pay attention and look out for the signs and symptoms and what you need to do if you think you might have it. So Tom, how can we reduce the risk to bowel cancer?
Thanks, Lyndsey. Yeah, so there's lots of different ways that you can reduce your risk. A lot of them we've gone through before. A lot of them we have lots of different presentations already done before, you know, on this kind of stuff. So following a healthy diet, eating nutrition, really easy. Things like eating more red meats such as beef, lamb, pork, really good source of protein, vitamins and minerals, which will help you sort of lead more of a balanced diet. Exercising regularly, making sure you're getting out sort of at least 2, 3, 4 times a week, just doing something that's going to raise your heart rate, get you panting a little bit more, and get that blood circulation around the body. Limiting your alcohol, making sure you're not drinking every single day, making sure you're doing everything in what we like to call moderation, so nothing too much, and avoiding smoking as well.
And what are the possible symptoms of bowel cancer? So what are we looking out for?
So the most sort of common ones are things like bleeding from the back passage, any blood in your poo, so just turning around, having a little look after you're done can really make a difference. Any changes in your bowel habit? Are you going more frequently? Are you going not as frequently at all? Is it harder? Are you straining? Anything along those lines? Are you feeling, is your doctor feeling any lumps within your back passage? Usually men will usually find this during their prostate examination. Any loss of weight and any pain in the abdomen or back passage, tiredness and breathlessness as well.
And what is part of the screening process?
Yeah, so the screening process usually, obviously detecting it a lot earlier means that you can treat it, and you've got a lot higher chance of survival. There is a home test kit that you can use, which is called the FIT test, and essentially all you would do is put a single sample of poo in a little pipette, and that would basically get tested. It's really the simplest test there is, and and what you'll essentially do is there'll be no need for any more tests or anything like that.
What are your treatment options if you find out that you have bowel cancer?
So the most common, obviously, is your chemotherapy and your radiotherapy. There are some biological treatments as well, depending on certain cases that you get. But usually the more advanced cancers will be treated by the chemotherapy and radiotherapy. If it is detected early enough, usually you can stop it from coming back. Sometimes it is you have surgery as well. Usually they won't take a whole lot out. And that, you know, it's near enough impossible for those advanced cases that it can be or it can completely removed or removed at all. But there are obviously it all depends on, you know, whether it's high risk, whether what stage it is, should I say, as well. So you know, symptoms can be controlled, and the spread of it can be slowed down with the use of certain treatment options.
So like you said, obviously treatment isn't always possible. So what's it like if you're living with bowel cancer?
So obviously, you know, hearing this kind of news is never going to be good for anybody. Some people take it differently, and some people need more support than others. So there are lots and lots of different supports that is available for you. Forums, you can talk to friends, family. You've always got to make time for yourself, and you know, really try not to overexert yourself as well. But if I go on to the next slide, it really kind of shows you the different links and the different nurses that you have available to speak to, cancer forums, cancer support groups, through Macmillan, Bowel Cancer UK. There's lots of different things that you can speak to, and of course you can always speak to your GP as well. And that is it. We've got some further information here for you guys as well. Like I said, those treatment options and the forums and the support groups are in the links before, and that is it.
Cheers, Tom.